Can we change that song to a Toke Thomas song?
This is the time we come together to keep our country safe forever. So open up your hearts, let a true love come right in. Cause love is all we need to make us stand. Let's understand one another.
All right.
And learn to live together.
Okay. Welcome, ladies and gentlemen, to the podcast of Action Require Media. Here we are dedicated to discussing hard truths and finding remedies for our problems. On this platform, we will stay engaged on all happenings in Mama Liberia, not limited to politics, religion, development, economy, security, crimes, war on illegal drugs, employment, youth, growth, and food production. Ladies and gentlemen, you are watching Action Require Media. Here we educate, entertain, and empower. You can find us on Facebook. Just search Action Require Media, or you can search Jeffake and Beard or Leo Montgomery. You can also find us on YouTube, Action Require Media. Please like and share our show. Please like and share our show. We would like for you to comment. If you want to be a part of the broadcast, please, you can contact one of us on the screen, and then we will bring you in. Again, ladies and gentlemen, welcome to Action Require Media. Today we're going to be discussing some sensitive issues pertaining to Mama Liberia. Here to discuss with me, I have my panelists. We have just fresh brains that are here to dissect and put back together issues that are hurting Mama Liberia. Again, our topics for discussion, but not limited to the healthcare system in Liberia and its problems and challenges. Second topics, we will be discussing the voice recording of a lady who claimed that Ebola is in Liberia and just spreading awareness that Liberians should be aware of the surroundings and how to go about doing things. So, ladies and gentlemen, again, we are here to discuss these issues. If you want to, you can send your comment in the message box, and then we will read it, and then we can get you on. Again, I would like for us to introduce ourselves. I will turn the time over to Brother Edwin for his introduction. Brother Edwin.
Uh, Thank you so much for watching Action Required Media. I know a lot of powerful people are watching behind the scenes for some reason. They're not commenting and everything, so we appreciate you guys. They look towards us for vision and direction. They really like the show. My name is Edwin Saipor Jr. I'm a writer, and I'm very happy to be on the show today with my panelists, Dr. Archibald Wallow. Thank you.
Thank you, Brother Edwin. So at this time, we'll turn over to the doctor himself, Dr. Archibald B. Water. Pastor Waller.
Yeah, thank you, CEO, and good evening, my brother Edwin, and good evening to our listening audience. It's always a pleasure to be here to talk about our country, Liberia, how we are together can work to move our country forward. So it's always an opportunity to be here to discuss. And then it will also be a great service to us if you can just send us, your comment and, suggestions how we can better improve our platform. But, thank you for being here, and I look forward to the discussion. Thank you, see you.
Thank you, Dr. Waller. Thank you very much. Again, that's Dr. Waller and Brett Edwin Saipor. So today we have some one of our members is having a special engagement, so he's not here today. Sergeant Montgomery. So I'm Brother Joseph Brown. I'm your host. So again, we're gonna go through our opening prayer. So everything we do here, we try to bring our Lord and Savior into it to guide us. So we will ask Dr. Waller to give us our opening prayer. Dr. Waller.
Yes, let us pray. Our Father in heaven, we want to thank you. We give you praise and glory. We bless you, Lord, for this platform and the opportunity you have provided for us to communicate with your children, both in Liberia and in diaspora. We want to thank you, Lord, for all that you have done for this country. We want to bless you for our leaders. We want to thank you for all Liberians. Even, Lord, as we hear the news of Ebola, this deadly virus, we pray, Lord, that you will cover Liberia and Liberians with the blood of Jesus. Protect us, O God, from everything and anything that could cause harm to our nation and its people. I want to thank you for President Boakai. I want to thank you for the wisdom you have endowed upon him to lead this great nation. I want to thank you for the Speaker and the House of Representatives. Thank you, Lord, for the President pro tempore and the Senate. Thank you for the Chief Justice and the Associate Justices and the judicial system. I want to thank you, Lord, for making our country a better country for all of us and for our posterity. Thank you, Daddy. We bless you. We honor you. We thank you for everything we discussed today. Lord, may it provide information for your children, and Lord, may it provide life as well. I want to thank you, Lord. We bless you now. In the name of Jesus, we pray. Amen.
All right.
Amen.
Thank you, Dr. Waller, for that wonderful prayer. Again, gentlemen, welcome to the show. Um, we're gonna have, um, you know, a great time today. I'm hoping that we can um, talk about this issue that is sensitive and see how best we can um, give our advice to the general public also. And again, welcome, gentlemen. So I think many of you have seen what is happening in Liberia on the internet. There is an information on the internet that is going around from Liberia about one of, I think she's a healthcare worker, and I'm going to play the audio. After I play the audio, we're going to go through the audio. We're going to go through the discussion of the audio and see how best we all can uh, dissect it and then just be aware. Again, one thing I want to make sure here that is clear that this show we are not claiming that Ebola is in Liberia, but we will be discussing the concern of the issue of Ebola in Liberia. Once again, we will go ahead and play this audio so at least everybody can hear it, and we'll go through it. It's kind of a little bit long, but again, it's something worth listening to.
I just started well for everybody to be informed about the latest issue in Liberia now. I'm just coming from a meeting at JFK. I want everybody to know that Ebola has already entered Liberia. Some group of people went to Uganda. They went on a church conference. They went for the church conference and they are back. And 5 of them are showing signs and symptoms of Ebola. Their eyes are red. Their rectums red. They are vomiting and having running stomach. JFK can no longer handle it. They already send them to the unit. Let's be very, very careful what we are doing. Let's take our hand washing very seriously. We got to keep safe to keep serving. I'm appealing to every one of us. When we're coming to work, interacting with patients, let's be in our PPE. If you're not feeling safe with the patient that you're treating, get your long sleeve on. Don't just go naked to any patient with short sleeve uniform. I'm appealing to every one of us. They just called us for a very important meeting, and what was said is what I'm thought it right to share to this family. I'm begging us. It is getting serious. Ministry of Health is hiding it. They, they think they're having things under control, but only God can help us. Let's take our precautions. Let us start to put hand washing buckets to our homes. Let's talk to our children to always be washing their hands. Let's talk to our neighbors. Let's try to make everybody know about what is going on so we can be on the alert. It's not time for any handshake. It's not time for any wrestling or anything. We got to be very careful. We got to be very careful. This set of people that came from Uganda, they are having suspected, highly suspected of having this Ebola virus. And to what I saw in the Congo one, they have not had any medication or any vaccine yet to help in reducing it. So let's be very careful. Let's be very watchful. Be very, very sensitive when you're taking care of patients. I just thought to let everybody know. Thank you. I love you all.
Okay. Thanks, guys. I think it's clearer.
Good evening, family. I hope
Impossible.
everybody is okay. I just
Hold on, guys.
thought it
I'm trying to pause it.
well for everybody to be informed about the latest issue.
All right. So, gentlemen, I think we heard what she said there. I think we will go through her statement she made to the general public about being aware of the Ebola that was suspected to be coming from those people who went to Uganda on a trip, and they are back in Liberia. So it was suspected. The symptoms are suspected of Ebola. Again, I've heard this lady. I have seen that lady has been arrested, and somebody did tell me she was bailed out. So we will go through the arrest video. But before we go to the arrest video, let's talk about this video. Let's talk about the recording. Gentlemen, I think for one fact, I'm not going to be the one here to criticize this young lady. Okay. And again, she's a healthcare worker. And she said they were called into a meeting at JFK, and they were alert. They were told about the incident or about the symptoms of Ebola, and they have lived Ebola, so they know what Ebola patients look like, its signs and symptoms. So the fact that this person or this patient has the symptoms of Ebola, they are being alert. For one fact, they alert all the workers at that facility, okay, that, hey, before you go into this patient room or before you go to another patient room, make sure you follow standard protocols, okay, of precautions, airborne precautions, contact precautions, whatever kind of precautions, make sure you follow it. Make sure your PPE are appropriate, okay? So I think that's the best thing to do coming from a higher institution or a bigger facility. We handle healthcare issues. The first thing, alert your people, let them know that this is here. This is what you need to do to be prepared for it, okay? Before we go into the video, let me ask the question here. Let's go around. What is your assessment, or what did you really get from this video? Do you see it as an urgency or something urgent for the Liberian people to be aware, to be able to create, you know, protection, um, to prevent, the spread of Ebola. We are not going to claim that Ebola is in Liberia. That's for one fact. We will not do that. Okay, so let's go around. Let's talk about your assessment of the audio, and how do you see it? If you see it's an urgent matters, or do you see it? Do you believe what this young lady said, Brother Edwin? Oh, Dr. Wally, you want to go first?
Yeah, I can go first.
All right, Dr.
I
Wally, you
can
go
go.
ahead.
Okay, and then my brother Edwin can come after me. I don't like to go before Edwin. Man, it's a powerful brain.
Oh, you're
Um,
gonna
so,
defend your data. You're gonna defend your data status right now. Go ahead.
but anyways, uh, let me just say a few things. CEO, thanks for playing the video. Um, so Liberia and Liberians have experienced Ebola, and we know how deadly Ebola is, most especially when we were faced with this issue during the former President Ali Johnson Sirleaf administration. It took Liberian lives. Some of the video at that time, when you watch it, if you don't cry, then I would doubt your humanity, because I couldn't watch the kind of suffering that the Ebola epidemic havoc on our country and our people. So every time Liberians hear about Ebola, it raises a serious national concern. But to just come to the video, the very first thing I want to say is that when the lady said that they were called in a meeting at JFK because she worked at JFK, the very first thing that I want people to know is that the fact that she was called in the meeting, that indicates or it implies that they are doing something about it. Okay.
Yep.
Uh, and there's a reason JFK did not tell all of their patients or the public about the very important meeting they had. So there's a reason for that, and I'm going to go into that later on when we go to the other video. But I want Liberians to know that from just this video, okay, I'm not talking about the government yet, but I'm talking about JFK as an institution, um, for providing health services, right? They did not keep quiet about it. They called people that they thought are responsible people, their staff, and enlighten them about the suspicion or what they suspected about other Liberians that came from outside of the country into the country. So I want Liberians to know that people are doing something about it. Okay, people are doing something about it. So that is the first thing that I got from the video. The next thing I want to say from the video is that the lady said it is suspected.
Yes.
Okay, what that indicates to me is that it is still a speculation.
Yeah.
Okay,
It's not
it's not a
confirmed.
fact. It's not confirmed, right? It said it is suspected that they are having or they are experiencing symptoms of Ebola. So Liberians also need to understand that whatever information that is out there, okay, it is not something that has been confirmed either by the health ministry or, or the government itself, right? It has not been confirmed. So there shouldn't be any public, fear about you going about with your normal activities. What I will join her to say though is what she said, from in the middle of her message, that Don't feel relaxed, okay? Because even let's assume that no one in the country have contracted Ebola. There is no Ebola in Liberia, but the fact that it's in another African country, that is more of a reason for us to be alert, for us to be careful, for us to go about our activities with diligence, right? Because the world now is a global village. You don't know who is traveling from where. People travel all the time. Things happen all the time, right? So you have to now pay attention. Okay, I would join her to say that reduce the touching, the handshaking, the hawkings, right? And those kind of things that will expose you to direct contact with people, right? Avoid, at least limit that. Be very careful with that. Be careful with that. Okay, that is the only thing I would say. But as we speak currently today, okay, there is nothing confirmed in Liberia that Ebola is in Liberia. What she said is that it is
It's suspected.
suspected, and
Yeah.
I want us to take it at that value.
Okay. Thank you, Dr. Waller. Erin, before you go in, let me just give a little statistics about the Ebola virus. Uh, so the Ebola virus from 2024, 2014 to 2016 in West Africa. So Liberia confirmed cases during the 2 year period was 10,678 confirmed cases. Total death 4,810. Now, if you look at the total casualties across Guinea, Sierra Leone, and Liberia, the virus claimed over 11,300 lives, with Liberia being the highest recorded. So, so now coming back and hearing that Ebola is starting is in Liberia is traumatizing to some people and many families in Liberia. So again, that's why I wanted to say before Edwin can come in, and then I will put my little 1 2 1 2 in there, brother Edwin.
Yeah, on this show, I love that the wall. I really do. I enjoy disagreeing with that the wall. I really do. I'm not a agreement person, but everything that the Wallace just said is 100% correct. What is the name of that girl? The girl that trying to create a precautionary stuff. What's her name again?
She is hold on, I can find her name real quick. Paula something. Uh, I'm about to put her video up on the header. I think it's Paula N. Bidell.
Well, that's a Congo name. Okay, but I feel like this is just me. I don't have a fact. I'm not a seditious. I don't go accusing people because I say so. This is just me. I think the girl's being paid to create fear mongering. What can this girl create a fear mongering of all the young girls that going through pregnancies and doing so? Why she can't create fear mongering? We have real health issues in the country though. We really do. What is this international recognizable name that is in the UN system that she's gonna make all these stuff about? She's gonna make us stuff about the code that you can just implement into the system so people can hear the name and say left funded or not funded. All the issues that young girls, young boys, people are going through every day. She can't make a rumor about it though. She can only make a rumor about Ebola. So I think she's being paid. You know what I mean? I'm not gonna go to say, oh, she don't have any verbal stuff because I think somebody paid her for her to create he kind of instability and stuff. I think somebody paying her. But Brian, go ahead. You know, that I want to say everything. That's why I'm not gonna say a lot of stuff.
So this is what I would say, right? I think this lady like I said, I'm not here to criticize her. Okay, if she was part of that meeting at JFK, okay, and I don't think she would have risked her license just to come out and spread propaganda. Okay, I'm not saying there's not possibility. It's a possibility. Okay, she's a healthcare worker. So the question here we should be asking ourselves: was there ever a meeting at a JFK where she was in attendance? Okay, we don't know. I tried session. I couldn't find any information about the meeting at JFK and so forth. Now, this is what I would say, right? If information like this is coming out, and the way she talked about the Ministry of Health, was downplaying it, like they felt that they had it under control, is concerning. Okay, now it could be it could be true that the healthcare department is downplaying this. It could be true that the government is downplaying this. Okay, for many reasons, many reasons that could affect the economy, travels, businesses, and so forth. And whenever travels and businesses are affecting Liberia economy, our economy goes down. Okay. Now, you all know we have two major airlines that go to that country most times, Air Morocco and Brussels. Okay. So, again, if it is true, it should be reported by the Ministry of Health. Okay. And people should be aware of this so at least they can take preventive measures. Okay. Now, let's say it's true, hypothetically. Let's say it is true. She has no right to leave a meeting from a bigger institution like that, like healthcare system, to come out and serve as a PR to the hospital. Okay. Every bigger institution has the PR. Okay. Wherein, things and information had channeled through them that they display to the general public. If she's not part of it, she cannot disseminate messages or information to anybody, regardless of what medium she used. Okay, talking to her family member, recording audio, and sending it on WhatsApp or doing it on Facebook. She's not in that capacity to do that. Okay, it could have been the PR from the JFK hospital or the director of the health ministry should have been the one announcing these things. Now, there could be, like I said, there could be many reasons why it could be downplayed too. Okay? It could affect the economy. It could affect the businesses. Now, do we take one case over 6 million plus people, or can we contain the one person and then restrict maybe travels into the country but don't have Ebola outbreak? Now, the person in, like Dr. Wallace said, she said it's suspected. Okay, so the person has not been diagnosed with Ebola. Okay, now if there are suspect of symptoms that kind of like match the symptoms of Ebola, it's okay. It's okay to be prepared and claim that it is what it is. But it has to be tested to be proven that it's factual that this is Ebola. Okay? And again, like I said, we are not confirming, we're not here to state that Ebola is in Liberia. But there's possibility that it could be, like Dr. Wallace said. We have chain migrations. Okay? We migrate every day, every hour, in and out of the country. So I was just talking to one of my coworkers at work. She confirmed her family are all nurses and doctors in Kenya. Confirmed there is one case of Ebola in Kenya, and the people are taking preventive measures. Okay? So she said it was reported to her by one of her family members. Okay? So I did go online trying to dig into it and see if that case was registered with WHO or CDC, but it did not come out. It did not come up when I did the research. So I like, okay, cool. You know, things happens. It might take time to be updated in the database. So I might check later on. But on that lady's side, let's say, let's say if in a week's time, or maybe 2 weeks from now, if it confirmed that a case of Ebola is in Liberia, is that lady being proven right? So
CEO, let me.
go ahead, Dr. Water.
Yeah, okay. With your question, let me say a few things.
Yeah.
Um, so I don't let me I want to I want to say that number one, that no one has come up to disprove or to discredit this latest statement of her being in a meeting where they were told about suspected cases of Ebola in Liberia. No one has done that, not the government, not JFK.
Yeah.
No one has done that. Okay. The second thing here is when she said that the Ministry of Health knows,
About it.
they are hiding it because, according to her, because they think they are in control.
Yeah.
Well, let me say this. Ministry of Health is in control. They are in control. They are not downplaying it. They are in control of it. That's why they don't want any public fear. This is not the first time Liberia is dealing with Ebola. The first time, you see, from the statistic you reported, 4,110 people died, because that was the very first time we experienced that. We didn't know about Ebola. We are a country and a culture that touch a lot. Someone said we touch them. We are around them. We don't leave our sick alone. We are a touching people. And that's why the Ebola epidemic affected Liberia the way it did. But now we are better equipped than previously. So I don't want anybody to be in Liberia or out of Liberia and think that Ministry of Health is downplaying this issue. No, they are not downplaying it. They are confident, and that's what I want to see from our government. A government that is confident about epidemics, that does not frighten the citizens. Because just think about it. Currently, we have job issues in the country. Young people don't have jobs. We are still struggling with that. We have healthcare delivery issues in the country. Healthcare is not accessible, and is also expensive, and it's not of quality in the country. We have border issue with Guinea. The government also is dealing with that. Now Ebola issue have come, right? So the government needs to know how to handle this issue. One thing I would say to the government is the fact that no one had discredited this woman. A lot of Liberians are giving her statement attention. The government now needs to control the narrative. Okay, putting her in jail. If I was advising the government, there has to be an explanation behind why she was arrested and put in jail. Because if government does not control the narrative, the way it's being portrayed and seen is that they are trying to shut her up. Okay, Ebola in the country, the government don't want us to know about it. They are trying to shut her up. That's to be the message I be saying. They have to control the narrative why she was arrested and put into jail. I want to say to all Liberians, at this time, I want to say this. We have to listen to our government. When issues like this is going on, we cannot have so many people saying so many things. It creates confusion and it creates instability. We have to listen to the experts. We have to listen to the people that are in charge. If the Ministry of Health says to us that we have no reason to panic, Let us believe that the major reasons Ebola affected Liberia previously is because the Liberian people did not trust the message that was coming from the government. They consider it to be, false. They thought that the government was saying it because the government wanted to access, international community funds. We have to now listen to our government. This is now our first time. The government is better equipped now. We have infill. Okay, we have infill. We have to listen to the people that are in charge of this issue. Then listen to them. Let us not listen to people on social media. They are not experts. Then listen to the experts, people that we have in our country that are experts. Dr. Yang, okay, the director, I don't know whether he's still director of MPhil or former director. He just had an interview with Al Jazeera. The international community are accessing people in our country, people that are experts, to talk about this issue. Why will we not listen to them? At this point, they say there is no confirmed case of Ebola in Liberia. Let's believe them. When they say there is a confirmed case, let us believe them. Let us follow our government. At this point, this is not political. This shouldn't be political. Let us listen to our government. Please, Liberians, let's listen.
Okay, Dr. Wallow, the point I want to get clear here to the fact where you said nobody has come up to this claim that this meeting or this young lady was not part of the meeting at the JFK. Um, and what I would say, you know, if it is suspected, it is suspected. It could be something different, but at least they were told it was suspected COVID case. I mean, Ebola cases, but not confirmed diagnosed case. Now, what if? Do you think there would be a narrative where the government or where the healthcare, the Ministry of Health, would try to downplay this? Do you think of any reasons why they would want to do that?
That's what I'm saying. I don't see any reason because
Okay,
if they downplay something like this, it's going to affect Liberia. It's going to affect the economy. It's going to affect all of the achievements they have made so far. Why would they want to downplay it?
okay,
What I see here, CEO, what I see happening here is a government that is confident that they have this under control. If
okay. Let me.
something changes, they will have the public informed. And this would be my caveat to the government. Please don't
Okay,
lie about this. There is no reason to tell a lie about this issue. This is a health issue. This here involves Liberian lives. There is no reason. There is no reason to falsify anything. There is no reason to hide anything. There is no reason to be dishonest about anything. Let us be truthful. I'm talking to the government. Be truthful to your people. Be truthful to your people. If you want to control the narrative and you want Liberians to believe you, you have to be truthful to the country. Don't
okay,
do it as politics as usual. Let this not be politics. Let the experts take charge of this issue and let them communicate to Liberians. I am not saying that this lady did not have the meeting. What I'm saying, CEO, is that it was not her place,
yeah,
okay, to say something about a confidential meeting
yeah.
she had. Okay, because what it's going to do is it's going to create public fear, and that's what the government don't want.
But
Okay, because when
again,
people start being afraid, the information now start going anyhow. By the time you see someone, because Ebola, Ebola and other sicknesses, symptoms, they look alike. So you have to be very, very certain and sure about that. I mean, you in a healthy, right? You have to be very certain about what is being communicated out there. And so it was not her place for us to done that.
yeah,
It was not her
yeah.
place.
I agree with you, Dr. Ward, on that. Again, this young lady put her license at risk for doing what she did, and she shouldn't have done that, to be honest with you. But again, she just thought it wise that maybe the information gathered at that time, she didn't see the urgency coming from the Ministry of Health. Okay, that uh, maybe it was told that the Ministry of Health had this under control. But if I were her, I wouldn't have ran with the narrative that this is a suspected case. If it was diagnosed and confirmed, then it's something different. Okay, so my thing is, look, it's a bigger institution. She doesn't represent an institution like that, and she's not dragging the entire JFK into a dilemma on the internet, which of course no one should do. I mean, I work for a bigger institution. I would never do that, okay? Because that's not my place to be. All right. If I've given information, the information is meant for me to protect myself and protect my coworkers and my patients. Okay. I'm not the one to go stand in front of the media and address issues concerning viruses that are affecting that facility. I wouldn't do that. Again, like I said, maybe she thought she would have been in the heroine here, to the fact that there was no urgency added to it, that people should be aware of their surroundings now, because like you said, Dr. Waller, we migrate a lot. We migrate a lot. Churches, businesses, family, friends, vacation. Okay, and Liberia is not a country sophisticated with medical equipments and technology to detect something quicker. Okay, so once it get into the country, it's gonna spread like a wildfire. Like you said, look. Let's say for example, if somebody who had that Ebola virus enter Waterside Market, what's gonna happen? What's gonna happen within 1 minute? What's gonna happen? Right at market. What is going to happen, Dr. Waller? So again, if something is suspected and is not diagnosed, I don't think we should stoke fear into the people of Liberia. And that's the point you're trying to make, and I think that's the point everyone trying to make. But this lady shouldn't be arrested for something that did not cause any negative impact in the society as well. She didn't give people. Yeah.
CEO,
Yes.
before my brother Edwin coming,
Sorry, Edwin.
uh, no, she's arrested because the government want to send a strong message. If you are not, if you are not certain about something that could be epidemic, don't just put it out there. Okay, don't just put it out there. And do you know the impact her message on social media has or had on a country? We don't know that yet, but the government can evaluate that. It was not her place.
So
Okay, it
so
was not her place
so Dr. Waller, before Edwin come again, Edwin, sorry
for
for
her
this.
to.
We we have government officials that participate in ECOWAS meeting, and ECOWAS are already raised concern about Ebola outbreaks in Africa. You know, pretty much, you look at Uganda and other countries, the Congo. Now we have surrounding countries that people leave those countries and come into nearing countries. Now we, like I say again, we are not sophisticated enough. West African countries are not sophisticated enough to detect this stuff. Okay, now
Bro,
the moment
CEO,
one slip in, it could be 1,000 added.
yeah, but what I'm saying,
I hear you
okay,
though. I
if
understand.
if people, Liberians went on a conference and they came back from Uganda or from wherever, and they had a suspected case, Enfield have already deployed contact tracers. Those
Yeah.
people have already been quarantined. That's why that's why they don't want the public to panic about it because they are in control of it. This is a government that is confident.
But
Okay,
Dr.
that's
Waller,
what I want to
Dr. Waller,
see. I don't
the
want to
point
see a
the
government
point
that is
okay.
panicking. I don't know
Let
what to do.
let make it work here, right? Let's say they travel by a bus, okay? And maybe there were 6 members in the bus that came from Uganda. I'm just saying something now. They went through borders and borders and borders. Handshake, stop, use the restroom, buying food here and there. Now, those I'm just saying now, those 6 people are quarantined. But what about those people that already met along the way? They
They will
transacted with
they will report
those
that and they will trace
those
them.
those people. Majority of the people don't even listen to the news. Majority don't even go on
No,
Facebook.
but see, they will trace them.
I understand.
They will
Yes,
trace
they
them.
should. They
We
should.
have, see, it's not like before. We have the infrastructure. We have Anfield.
Yeah,
Besides,
I agree that the water.
besides Ministry of Health,
I'm
we
just
have
saying.
Anfield.
I'm
They
just
will
saying.
trace them.
Regardless of the
Okay,
six,
for me to be honest with you, I like the posture of the government. Okay, the government is not in a panic mood.
and
So
shouldn't be.
I don't think we should be in a panic mode. The government is not panicking. Okay? The government is confident about this issue. If there is something, if something change, then the government, I will hope and expect the government to communicate that to the Liberian people. But as we speak currently, let us have faith in our government because this is not the first time. Okay, we have if the infrastructure is not 100%, we are not starting from scratch. We are not starting from zero. We are starting from our experience we had before. So that's what gave me
Dr. Waller.
confidence, and that's
Okay.
what I appreciate.
Let bring
Let
brother
my brother
Edwin
Edwin
in.
come
Let bring brother Edwin in. Brother Edwin. Brother Edwin, come.
I couldn't. Oh, oh my gosh! I couldn't help that the water is trying to say with her expert like, bro. Are you kidding me? We leave it up to the experts. Which one? Name the expert. Name that one expert that you know in the government right now. Can you name it?
I did.
Name that one expert. No,
He
can
did.
you name that one expert?
Dr. Yang.
Who is that the young? What does
He is the director for Anfield. He was just
I
on Al
need
Jazeera
to
the
I
other day.
need to get if you tell me that the young I need to get into the background who you vote for because science in Liberia is not science. It's just how you lean. That's what
Come on,
science is.
Edwin. Come on, Edwin.
So this girl, right? She's panicking. She heard a conversation. She want to blow the alarm to her people. She's panicking. She was in a super secure meeting that she heard this stuff. Now she's panicking. She's in jail? Are you kidding me? She's in jail. Okay. Okay. I can believe this girl because she's panicking, or I cannot believe her because she's trying to spread propaganda. Because Liberia is not a target for this stuff right now. There's a lot of stuff going on in Liberia in the healthcare field that people can voice, that she can be on the radio about every day. If she want to play hero, I know how to make her play hero. She can call my phone right now. I will make her a hero in Liberia. She can call my phone. 100%. WhatsApp, whatsoever, directly, I can make that girl a hero. Even with her job, losing her job, I will pay her a poor salary. If she want to be a hero. No, she don't want to be a hero. It's either she's spreading propaganda or she's actually scared. That's the two things. Either that. She's either want to like save people or she's actually trying to put fear in people. But I know what that girl, she in jail right now. Y'all give me her information, I will free her. I know what she can put on loudspeaker, what she can actually make a how you call it impression on the not the Liberian government but on the Liberian people. I know what she can put her loudspeaker. It's not Ebola. It's not gonna be Ebola. It's gonna be among young people, young female, young people, all that stuff. It's not gonna be Ebola. So no, 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 no. There's no aspect in Liberian government that the world. I'm sorry. Start saying the aspect stuff. I know you learn this stuff from in America. You just learn, you just transporting your languages to
But
Liberia.
Edwin,
Like they think
Edwin,
it's okay. It's
Edwin,
not okay.
Edwin, I think it should be called out. Okay, we have experts in Liberia that handle the matters of diseases.
Bro,
Okay,
you can't even
like
say
the
the
water
word
said,
aspect without fixing your mouth correctly. You can't say
we have expert. We have experts. Okay, we do. No,
in
I'm not.
Liberia, bro.
No, yes, we do.
Okay.
We do. We do. We
Okay.
do. We do
Okay.
have doctors, renowned doctors in our country that know what they're doing. You can say to some extent that this facility have not been fully funded to operate in a maximum capacity. I would agree with you with that. But to say that we don't have the brain, I would disagree. We do have the brain. We have the
I know you're
personnel.
trying to
We
make
don't have the
your
we don't have the
Apple experience
logistics.
smooth. That's
No, we don't
okay.
have the logistics
I want to go
for
through the
those
Apple so people
for
can
those
be
facilities.
fighting me and stuff.
All right. So the next question here, right? Will you okay, Dr. Wallow and Brother Edwin, will you say it was okay for the government to arrest this young lady?
100% no. 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 They girl, the girl either panic or she either telling the truth or she panicked. Why would you want to arrest her though? There's a lot of people could be arrested and like, bro, why this girl? Why? No, hell no.
Dr. Wallow.
You see, that is where I expect my brother Edwin to say that most of the people that are hindering government communication, they are all propagandists. Okay, they are not expert in communicating. They have no strategy. They have no plan, nothing. Okay, this is a government that is now reacting. They are not proacting. They are reacting. Okay, if our again advising this government, I was going to advise them to do it differently, not to arrest her and put her in jail. Okay, because what that signal or what the message is sent is that you are trying to shut down someone who is trying to provide good and concrete information to the public. Okay, that's how it seems like. The government could have done it differently. Okay, they could have done it differently, but the way they did it, I don't think it was. I would not say wrong. I mean, I think what they want to do is they want to send a strong message, but that is the wrong way to send. Well, that is not an effective way. Let me say, an effective way to send that strong message right out there. It is not effective. I could have advised them to do it differently, and I can even recommend something here, but I'm not going to do it on this platform because they're not paying me for it.
Okay, Dr. Wallow. So, Brother Edwin, this is my take on this, right? Uh it's a recording that was going around. Okay. So I don't think this young lady should have been arrested. Um if it was different scenarios or different case for the matter, let's say she went to Kiss FN or she went to a broadcasting uh television system place, went to a radio station and tried to talk about the issues where she was in a meeting at JFK and then try to talk to the people who are, and people are listening, and it's been televised, and people are hearing the radio. Now, I would say yes, the government should have the right to go and arrest her. Okay, I would say that. But if I just pick up my phone and did a recalling, okay, and I sent it to my family member, say, let me send to Edwin. I say, brother Edwin, check your WhatsApp. I send you a voicemail. Brother Edwin play the voicemail and send it to Peter. Peter take it and send it to Mary. Mary send it to Paul and this that. I don't think that should. I'm not saying it's not information being, going around. It is, but to a certain extent, if it was done differently, I think yes. But just this, anybody could be playing, anything. But I don't think that young lady will love to put her family in a race for just saying something that she doesn't know about. And again, Dr. Water said nobody had come out yet and said this young lady was not in the meeting at JFK where we discussed these issues. Now, the point we making here is it was suspected. It doesn't mean it was confirmed. So again, she said suspected. Okay? So I think, they could have just allowed her slide. I know, well, she got out anyway. But again, um, we should be very careful how we use our security apparatus on our citizens.
Yeah.
To arrest
It-
them. We should be very
yeah.
mindful. Very mindful.
Wait, brother, like,
Can I say
see the
something
top,
quickly?
wait, that the water with it. The topic is so westernized. This is a westernized topic, okay? I don't know how the topic was picked. I know we try to go the opposite of what everybody talking about. This is a westernized topic. Should she go to jail or not go to jail? Should she expose Ebola or not? This is not the everyday stuff like Laverne people are going through. Okay, the crime that she creates an upper echelon crime. She's in JFK. She see this stuff. It's not supposed to be. How many people covering the thing? My brother have a newspaper back home. He not covering it. They put a newspaper on last week. Friday. They put it last for this week stuff. Sylvester Brian, he didn't put a newspaper on about the girl or whatever. So what are we talking about here? Go ahead, Dr. Waller.
Yeah, and I think the CEO were making a very important point. I wanted to, also emphasize that the fact that it is a recording, she may have recorded it, sent it to a friend,
Yeah.
and a friend may have forwarded it to her friend, a friend forwarded to another friend forwarded to another friend, and then you want to tell me, say, what we are doing here, analyzing her statement, the government officials couldn't do that?
They should have done it.
You want me say they couldn't do what we are doing. They couldn't bring this lady in and ask her few questions. When did you have this meeting? Were you told to disseminate this information to the public? What was the intention? What was your intention when you disseminate the information?
Yeah.
There are so many things that they could get from her to counteract this narrative. You said in your message is suspected. When something is suspected, you think it is confirmed. You know, there could have been so many ways they could have gone about this issue to just counteract this entire narrative that is out there. But arresting her and putting her into jail, I think it was the wrong way of sending the message. It was not an effective way of sending the message because we don't even know whether her intention of recording this video was for her to put it in the public. We don't know that. We don't even
Yep.
know whether she was the one who posted this
Yep.
message in, and we don't even know any of that. Maybe the government knows, maybe they know, but we don't know any of that. So there are so many pieces of this statement that we really don't know. But putting her into jail, I don't think was the most effective way to go about it.
Okay. Thank you, Dr. Water. So we will go around 1 minute each, and then we'll go on to the next topic with healthcare. If you were in her place, will you do anything differently? Before we do that, before we go to that question, let's watch the video of her being arrested, and then we'll go from there. Okay. I already see her name out there, Claire.
Moving my side, go so. We are here at the Liberia National Police. This is the suspect of the disinformation declaring suspected Ebola case.
All right, guys. So that's just a video there. I was trying to give her full name. I'm trying to make it up here, but I know it's Paula.
Yeah, what is a full name? She out of jail or not?
I think I heard somebody say she's out, but I'm not too sure, to be honest with you. I heard she was out.
Well, she need to be. We need to bail her out for
How
real.
how this
This is
how
a
this
joke.
is a
This is a
criminal
joke.
offense?
That the whole, why you mad?
Yeah, but how it is a criminal criminal
But you
offense,
you heard what he said, right? Suspected claim.
right? How this is a criminal offense that they put handcuff on her hand? You see that is the thing. Police went to go arrest her for what? They came out to police station to do what? Did she commit a crime? I thought they took her to healthcare, practitioners or healthcare experts to interview her or to talk to her about what she said. They came out to police station for what? Did she commit a crime?
Yeah, I'm trying to get her full name. I can't get her. I wish.
It's I mean
Is that
it's not it's anyways.
that the word is anyway. But to be honest with you, I don't think it was necessary to do so. Like you said, this lady could
But
have
what's
been
the crime she committed?
she could have been
What is the
contacted.
crime?
A lot of people commit crime in our country and walk free.
Yeah, but see, what is her crime?
I don't know.
What is what's the crime?
Suspected Ebola case.
Okay, what is the crime that she
Suspected Ebola
committed?
case. I'm just saying, suspected Ebola case.
I'm not this. I'm not gonna opine on anything in the woman stuff, except we know her name, so we can bail her out, so we can like bring her on this show.
Come on, man.
That's all I'm gonna do, bro. Like I'm not gonna go back and forth. She's a
The woman
hero.
already in trouble for putting stuff on social media. You think she will come on social media again?
No,
What
let
is
her come
her crime?
to
What
me
crime did
that.
she commit?
We're gonna bail her out. We're gonna bail her out. Let her come here.
What crime did she commit that they put handcuffs on her hand? What is her crime?
Brother Waller? Yeah, she's Paula N. Bidell. Paola N. Bidell.
Brian, do your social media magic. Let's talk to that lady. We need to bail her out. Like for
No,
real.
but honestly
They're
speaking,
having a damn
like
mind.
people when people hear about it, and maybe that's one of the reasons why she did that. go on Facebook or any social media live to disseminate this information, okay? Because she doesn't want to stoke fears in the people. So apparently, she did it purposely to a family member, okay? And like, hey, guys, be mindful of what you do when you go around people or you go places, going places. Look,
Can I ask you
it,
a question, a quick
go ahead.
question?
Go ahead.
I saw an ambulance. Was she in an ambulance?
I think that's the ambulance they use. I don't know. I don't know. I don't want to lie to you. I can't say to that fact if she was in the ambulance or not. I can't state. But I did see the ambulance too. I thought she was in the ambulance, but I can't confirm that. So again, gentlemen, let's say this, right?
CEO, it just all over the place. Now you're going to arrest someone who says something about Ebola, a public health issue. Then you take with you an ambulance with sarin on it, right? You think what the public going to think? Oh, they went pick up Ebola patient. Yeah, that's what people
No,
going to
but
think.
Dada Wallo though, Dada Wallo,
That's what people going to
Dada
think.
Wallo, if this statement was false, right? If that meeting was never held, I don't think this lady will want to implement the Ministry of Health. Okay, she did say the Ministry of Health is thinking that it got it under control. So apparently there was information that came from the Ministry of Health that, hey, we got this under control. You know, let not everybody be panic.
Look, there
That's how I
is
look at
so
it.
many ways. Yeah, but there's so many ways the government could go about controlling the narrative of what this lady put out.
Yeah.
So many ways to see what we are doing just from her statement alone. There are so many positive things you can get
Yeah.
from her
Yep.
statement
Yep.
to calm the public and to turn her statement into a way that it does not infer on what she did not intend or intended it to be. Okay, people are intending it to be what they want it to be, but the government can control the narrative. The government has a bigger platform. Okay, they can control that.
Okay.
But
Dada
all,
Wallo,
all they do is all propaganda.
let
So they
play.
are not effective in their communication. That is the issue here.
Okay. Let's go to the if game, right? So let's say if this lady was right and the government is downplaying the uh, claim that uh, the diagnosis that Ebola is in Liberia, what would be the reason uh, that the government will want to downplay the claim of Ebola in Liberia?
You asked the question before, and I will
Yeah,
say again that the
economically.
government is not downplaying it.
No, I'm not. I'm just saying let's play the if and if game. I'm not saying, uh, but we can't be certain
Yeah, but
that it
I see that
doesn't.
I don't see any reason the government want to downplay.
They could downplay for
If there's a
economic
case,
reason.
no, but CEO not putting information of such in the public gear means that they are downplaying it. Okay, again, the government could be confident that they have things under control.
But equally
Look
so
at
too.
one
Equally
second.
so too. If they downplay it, there are a lot of
The
different.
COVID. Look at the COVID-19. COVID-19 affected a lot of other African countries, but it did not affect Liberia because Anfield did a pretty good job with that. Okay, the government, President Williams' administration did a very good job with that, and WHO commended Liberian government for that. That's what I'm saying to you, that we are not starting from scratch. There are so many things that are now in place for pandemic or epidemics. Okay, we are not starting from scratch. We may not have it 100%, but we have a little infrastructure that can help us. So let not Liberians be panicking about what the lady said. The lady did not commit any crime for her to go to jail for any reason. Okay, she did not commit any crime. The government is just don't know how to control a narrative like this, and that is something they need to learn, because who knows? Today we are talking about Ebola. Just recently in the United States, it was reported of Hunter virus.
Yep.
Hunter virus. Okay, there are so many issues that that is going on in the world. So they need to learn how to control narrative. They shouldn't just be, propagandists. They need to know how to control narrative. They need to learn that.
Even with the fact that Ebola is in Uganda, the Congo, and this that, the Americans, CDC, they are pretty aware of the fact, so they know what to do when it comes to a point where they're going to start quarantining people or denying people flight access to the United States. It's going to happen. So they will prepare the public and let the public know you cannot travel to certain country at a certain time. And if you do, you're going to be quarantined for X amount of time. So I think we should be proactive in Liberia when it comes to the health ministry. We should be proactive. Those people who came back from suspected countries, okay, Uganda, the Congo, and this that, those families should be quarantined, and it should be monitored by the Ministry of Health. I think they should take flight
But,
records of
but
people.
we don't even know if that is happening. Look, if people came from if the people came from the Congo or Uganda, they Anfield is on top of that. They're going to quarantine them. They're not going to let them go like that. They will quarantine them.
Well, Brian, I don't know what we have the lady as our topic. That lady is a hero. I don't know what we have as our topic though. I don't know. Yeah, like that the world talking about expert in our government. What are you people towing chair from room to room? Are you kidding me?
No, Sam,
Like
look,
I
look,
like
look,
come on. Put the
look.
lady on
When
the.
when it
Can
comes
you
to
do your
Liberia,
social media
look,
stuff and get
when
that
it comes
over
to
the
Liberia,
recipe talk to her man?
Liberia have brains. They have educated people who are specialized in different fields and capacity. Look, I would not downplay these people, but what I can say, their
That
ministries
is
have been
all true.
underfunded.
We are not
Okay,
downplaying
no,
them,
but I
but
can't.
we need
But,
to get
but
that lady over
I would
though.
not agree with you to the fact that we don't have experts in our country. We do. Okay, we do have experts. It's just that the
Brown,
facilities and
this is where
the
me, you, and Dr.
logistics are
Wallo
not there.
100% disagree. We don't have expert.
We
We
do.
do not.
We do.
Whatever you want to think to go sleep good tonight, no, we don't have expert. And I'm
We
going
do.
to sleep with this stuff. I'm going to sleep sound. You guys going to be there. You have expert. I don't. We don't even have 2% expert. So you do whatever you want to do with it. You enjoy it.
All right. So Dr. Wallow and Brother Edwin, now we're going to transition to another topic, and the topic here is going to be healthcare. Okay. Let's look at the healthcare system in Liberia overall. So we're going to be vague. We're going to go all over the place, and then maybe sometimes we may be specific. Okay. Um, let's look at the healthcare system in Liberia overall. Let's try to pull some things down and up. Um, I would say the healthcare system in Liberia is not at quality as it should be, um, and because of lack of staff, equipment, logistics, lack of technologies that will upkeep us and with information about ongoing processes in um, diagnosis. So again, we are not there, and that's why most lawmakers and family members and friends are leaving the country, going to Ghana for minimum surgery that could be done in Liberia. Okay, now the healthcare system in Liberia is broken, and it's sad. It's very, very sad. The Liberian people cannot build the healthcare system, but the Liberian government can build the healthcare system, but they're not finding interest in building the health system so that we can have stronger and longevity in Liberia. We can have sound minds in Liberia that can counter. We should have brilliant surgeons in our country with all the equipments and technology. Okay, we have easy access to the United States. There will be no reason why we can send medical students here to the States for studies and come back to Liberia and pay them just as they are getting paid here in the States. But we do not see it as an interest for the country. A country who has no good medical facility, the population cripples, dies with diseases. Okay? So, what would be so let's go back. What's your overall analysis about Liberia healthcare system? Brother Edwin, then I'll go to Dr. Waller next. What do you think about Liberia healthcare system? Quality, equipment, personnel,
This is what I
pay?
think though.
Yeah.
A shoemaker does not need to form terminology how you can produce your shoe. The fact that you are breathing, you're trying to find all the terminology in your brain to come to the healthcare stuff. Your prognosis and all the different doing. They just tell you that it's already bad, bro. You trying to walk so calmly. It's like you're walking on plank over water or stuff. You don't want to fall down. You just putting all the terminology in this that. No, Liberia have been very exemplary, right? Liberia have been exemplary when it comes to leading Africa and stuff. We very again, I always say that. Like Liberian, we have 15-year-old that were doing the wire and stuff. Oh, what West Africa were way ahead of other people. But people never try to thrive on these things. So they choose the regressive mindset because people has to be done. They want dumb people so they can vote for them. But when you're talking about Liberia, our country, and you know that the world will start giving you hard time and stuff, but our country we've been setting the example for people. So we should have all the experts and all the different stuff. But the truth is, don't lie to yourself. We don't have them right now. We don't. Don Bosco's still over there, but we don't. We really don't have these people. Do not lie to yourself and tell you say, "Oh, I got it because Liberian people used to be this, so things gonna happen." No, the truth of the matter is we don't have these people, and we have a lot of dumb people, and we don't have an education system. We don't have the same Liberia like you and I are talking about. So you need to be truthful to yourself. Don't lie to yourself because you want self glory or past glory or whatsoever. Do not lie to yourself. Are we capable of having the aspect? 100% we are capable. Are we capable of leading Africa again to direct them? 100% we are capable. But we don't have the leadership in place to bring up these same Liberian people that were the first people to bring all the root, the turpentine and all this stuff, the mechanized agriculture, the modernization, turpentine. We don't have anybody doing that right now. It's not Joseph Barker. Don't lie to yourself. Are we capable as a country? 100%. We have a lot of smart people. There's more Dr. Wallow, more Nia Brown, there's more Edwin Paul rising up in that country right now. We just need people to guide them.
All right, brother Edwin.
But we
Okay.
cannot lie to ourselves about what's going on right now. If you want to achieve the reality of what we used to be, don't lie to yourself. Stop lying to people. Start telling people the Ebola nurse need to go to jail. Stop that. Stop it.
All right, Dr. Waller. How do you see
Yeah.
the healthcare system in Liberia though?
Yeah, before I respond to that, I want to encourage my brother Edwin. The I want you to read on the National Public Health Institute of Liberia. Okay, read about it. and then also read about their leadership structure, people that are, that are in leadership there. Okay. Um, so on the healthcare thing, you see, CEO, every
I
time,
will. I'll need my glasses though, but I will.
okay, thank you. Every time you talk about healthcare, the very first thing that comes in people's mind is a patient in a hospital getting treatment. Okay, that is the limit of most people. But healthcare is more than that. Okay, we are talking about leadership. We are talking about administration. We are talking about personnel. We are talking about infrastructure. We are talking about equipment. Before we even talk about the delivery
Yeah.
of it, right? Now, the question here is, with all of these complexities of what healthcare entails, which one we have and which one we don't have,
Mm.
where we're supposed to be focusing, right? In Liberia. To me, all of these levels of healthcare need to be strengthened. Okay, it needs to be strengthened. The reason we don't have quality healthcare in the country, I tell you the truth, it's not that we don't have personnel, okay, but we don't have quality administration, quality leadership. We don't have quality infrastructure. We don't have quality equipment. So even though the personnel are there, but we cannot produce quality healthcare because we don't have the quality of all of the things that we need. So right now, if you were to take a survey in the diaspora of Liberian surgeons, of Liberian general practitioners, of Liberian doctors, just in the diaspora, do you know how many people you will get that are Liberian doctors in the
A lot.
diaspora? A lot, a lot. But are we encouraging them for them to go home? No, we are not encouraging them to go home because we number one, we can't even pay them.
We can't pay them.
Two, we don't have the infrastructure,
Yep.
right? We are not making any frantic
Leeway.
effort in developing the healthcare system in our country. Why? Because we have no interest in it. We just talk about it. We just talk about it, right? No concrete interest in it. So someone show up, at a hospital, and they just get what is available. Anyone hold the nurse or the data physician or the doctor responsible, accountable for how they spend or the services they are providing? I don't know. What is the quality of our licensing board in Liberia? What is the, my brother Edwin is talking about education. If we don't even have quality education in the country, it weakens everything. Okay, the students that you produce, can they defend what they learn? Okay, the people that are going to those health institutions, okay, how solid is the curriculum they are being taught? Who is evaluating those curriculum? So healthcare delivery, healthcare is a broad issue, right? But my point here is we are not serious about bringing together all of the dynamics that will produce a quality system of health for our country. We just talk, 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 and there is no concrete work that is being done to it. Okay, we need to, I know in Liberia everything is politics, so there is no way we can take politics out of these things. So if we make our politics better, CO, a lot of things in the country will be better. That is, if we are electing people because of substance, because of vision, because of what they can deliver, and now what I can get from you today, and let you do whatever you want to do for the next 6 years, then our country will be better. Everything is politics in the country. So when we make our politics better, a lot of things going to be better in the country.
That's so true.
Dr. Wallow,
That is so true.
we used to be frisky in our West Africa. Frisky. That brown over here when we eat Ghana was walking among the Ghanaian people that we went to the moon. In our West Africa, we used to be frisky. I was in Accra. I lived in Accra for like almost 2 years before I came on the refugee camp. We used to be frisky. Cause a lot of poor one Liberian people, they thought we had a border with America. This stuff is not about politics and this. We spill too much blood on our ground. We need to beg God. There's so much blood on the land that is not Liberian people were directing everything. People were coming to us. Kwame Nkrumah was being groomed by Tobar and Todman. They were coming over there. Ethiopia were coming to us. People were coming to us. But we can't do that right now because we spilled too much blood on the ground. There's too much blood. And because of that blood, we can talk all this stuff. We can try to pontificate. We try to put all the. I'm out of terminology. I want to speak Liberian English. We don't. We can't. We can't. We have to address the blood issue.
How do we
There's
do
so
that?
much blood on the ground.
I
With
would
so much blood on the
I
ground
would tell
that
Brian
what we
Sly.
can make sense. That's how we can make sense.
I would tell Brian Sly. All right, but to be honest, Dr. Waller, I think the premise you laid about the healthcare system, like I said, is too many things in the healthcare system that need to be addressed, and none of them have been taken seriously to the fullest, or supported to the fullest in Liberia. You talk about the administrative part of it, the infrastructure part of it. Employees, we do have the employees, but how well are we preparing these nurses and nurses practitioners to be able to counter um, patients? And again, that would depends on uh, our determination to excel and keep up with the Western world on how we update our healthcare system and our education system. But again, to a point, I think healthcare is universal. It's a big topic to talk about, and I think is also a money making uh, aspect where the government can make more funds. But in other sense too, the government should be able to make sure healthcare is
Brown,
provided is afforded
brown Liberian people
to
in
the
Africa.
poorest people. What's Edwin?
Brown Liberian people in West Africa or in Africa, we always have the eyes of all the African because we are the only people that penetrated the Western world. We're in America over here. We always had everything that nobody had. How does it turn around? Too much blood, bro. Too much blood.
Yeah,
That's
but
how it
Edwin,
turn around. That's what we can
we
see right
understand,
now.
but we can't pin everything on too much blood. We have people who have the technical know-how to transform that nation. I think we're doing it deliberately because there is no repercussion or there is no setback for these people who are running the country. Look, the healthcare system need to be transformed. Okay, don't get me wrong. Look at the JFK building. That's a unique building. I don't know what year that building was built, but it's a decent and unique building that can be compared side by side to a westernized hospital in the United States, even though it was built by the United States. Yes, but do we have the logistics there? Do we have the proper equipments there to be able to run that hospital effectively? No. We can't depend on America all the time to be giving us equipment to run the hospital. We have a functioning government, okay, that solely budgeted their national budget towards salaries, then focusing on institutions that will make the country better. It don't make no sense to me. Why would you pay more in salaries than benefiting the other departments? Look, Ministry of Education. That sucks. Okay, if you have the Ministry of Education and your Ministry of Health down to the floor, come on, bro. Who are you raising? Who are you protecting as a generation to come and protect that nation? Longevity, I don't know what's the liberal longevity anymore. I think for men it's like what 50, 59, women like 60, 70 something. That's that's way too young. That's way too young. You know,
Oh yeah, you're talking about life expectancy,
life
right?
expectancy. Sorry,
Yeah,
yes, life
I,
expectancy.
I
That's
haven't
way
checked
too
that in a
low.
while.
That is
No,
way too low.
no, but
But again,
Brian Dr.
again,
Wallow, have you guys read the Book of Chronicles?
what's going on, Edwin?
Have you guys read the Book of Chronicles?
Not the entire book for me.
Like, if you read the Book of Chronicles, what do you think about it?
Edwin, let's talk. Let's talk
Because
about. Look, we
no,
can
no,
go. We
no,
can go.
no.
We
Then
can
what
go
I'm
religious
saying
a little bit,
is
but no, Edwin.
no,
Let's
no.
talk about the.
I'm not trying to be religious. When you're looking at country like America that is so prosperous, and then you gotta go into stuff. You're trying to fix stuff. What is witchcraft and in power? That's what you're trying to fix, right? You're trying to fix your country
So you're telling
that
me
is
the
ruled
witchcraft been in power since
that is ruled by the
1847?
warlord.
Look,
They're still in power because there's so much blood on the ground. They're still in power. So
Edwin,
you trying to
Edwin,
fix that? Right now, if I go to Liberia, I'm not
Edwin,
going to fix anything. I'm not going to
Edwin.
go to Liberia and say, y'all need to do your healthcare this and this. That. I'm going to go pray. Put my hair flat on the ground so God can forgive the land, so something can come on the land before I even speak. I'm not gonna go over there and tell these people that are trying to quote unquote repeat what America have in America. They call it restaurant. What America have called it a beach. What America have they're repeating. They're not getting new information
Okay.
because the land is full with so much blood. You need to unleash it need to be clean.
All
You
right,
know, you
Edwin.
need to be clean. The land has to be clean before
Well,
you even talk to God about new information.
okay.
No, you're not
Well
gonna have
taken.
health care. You're not gonna have good government until that land is too bloody. It's too bloody. I'm sorry.
All right. Well taken. So that the wallow, I mean, to the fact where we're talking about. Look, Edwin, you got your formal education from Liberia. I did. That the wallow did, and most of us here, in the diaspora, we did. Okay, and our parents did get their college, education from Liberia, and they came out pretty good. So I'm not going to cast that on the entire system, but I'm going to cast that on this present system in Liberia. They are not taking education seriously. They're not taking healthcare seriously either. So I think the the government of Liberia should re-examine themselves and revisit how to do things and put more priorities on things that are necessary to grow the country. Healthcare, education, these are pretty um, important uh, place in government that need to be. Look, you were in Ghana. You want to school in Ghana. I want to school in Ghana. We saw what Ghana education system looked like. Okay, these guys are pretty structured when it comes to the education system. We had the same thing. We were structured. We were pretty decent until we started taking funds from the education system and started not paying teachers and education staff right, and then things happen. Even though the Civil War destroyed so many things in Liberia, but yet and still we still have a lot of great people in the country. All right, so that the water. I know we out of time now. So what we'll do, we'll go around again. If anything you want to cover up, I want to touch on the two topics that we have discussed. Something that came back to your mind, something to refresh your mind. Let's talk about it, and then we can go to our closing statement. Um,
Yeah, no.
Anything?
The only thing I would say is that I see my brother Edwin is very passionate about this cleansing Liberia, which is a very good thing.
Yeah,
We can talk about that another
yeah,
time, because is very important, Edwin, and
Yeah.
I appreciate you,
Recognizing it.
reflecting and reminding us about, our dark days. Um, the war still has a huge impact on the country.
Yeah.
Okay, most of the people that we see in leadership position today in a country, most of them are former combatants, right? What that means is that we have not putting behind us, we
Yeah.
haven't uh, accelerated in a way that we have placed behind us this experience of the war, right? So I agree with you, about this issue. However, just think about this, my brother Edwin, CEO, the kind of healthcare system we have in Liberia. If we had that system in America here, what do you think was going to happen? A lot of people were going to die.
Oh yeah.
Even though we don't have the sophisticated infrastructure, we don't have the equipment that are needed, but the little that those nurses have, they are doing well with it. The little skills they have, they are doing so well with it. Okay, we don't hear, I mean, they make mistakes here and there, but on a broader scale, for us to hear about disturbing stuff, you don't hear about that, right? So these people, that are working in the healthcare field, they are doing great, and we have to give them the credit because they are working with very minimum. They are not being paid well, and they don't have the infrastructure that they need around what they provide, right? So we need to consider that. Now, Edwin, just think about this. The kind of healthcare system we have in the United States, if we had that in Liberia, what do you think was going to happen? A lot of our people are going to live longer. Okay, a lot of the things that we are struggling with, we were not going to struggle with them, right? That is where we need to come. We need to acknowledge what we have and speak of where we need to go, what we need to be, right? But if we put down what we have and we say it's nothing, then we'll be discrediting the effort and the work that other people are doing in the country to keep other people alive, to keep typical Liberians alive. The people that don't have the money to travel outside of the country to go get, sophisticated treatment. Okay, we need to honor them for making those kind of sacrifices, for working for very little, okay, for putting themselves in harm's way. A lot of nurses died during the first Ebola outbreak, right? Because they were trying to care for their patient. They didn't have no PPE. Okay, they put themselves in harm's way, right? Because they were trying to care for their patient. So they are doing a lot. We just need to speak. We just need to speak of where we need to be, where we need to go as a country. While we acknowledge, the excesses we have in our institutions, right? But we need to speak of where we need to be. Okay, we have little, but God can use that little to bless the many. Okay, it's not that Labrador does not have something. We have something. Okay, let's acknowledge that, and then acknowledge the work that these healthcare practitioners are doing in the country, while we push our government, our national government, to do more to build the infrastructure that will help more Liberians, that will give us a better system, a better healthcare delivery, so that our people can live longer and they can have the care when they desperately need it. I think that's where we need to look at. That's where we need to put our emphasis.
Yeah. And that I
Well,
want
Brian, I
to
don't know. This
to
is
one
closing,
thing
but
you
I
said.
have to. I have to close though. I have to close. 'Cause I gotta go to my son graduation in like 40 minutes or something.
Go ahead, brother.
But were you trying to say something before I
Yes,
interrupted?
we'll soon close. So, Dr. Waller, I think what you said is all true, but I think the government of Liberia, whenever they're making the fiscal year budget or wherever they come up with the budget, they should put priorities to where priority belong. I think the healthcare system needs more funding, the education system needs more funding, and I think lawmakers should see it as, you know, as urgent as it is to educate our people. If we want the continuity of Liberia, if we want sound minds to run our country, if we want to raise doctors, lawyers, and ministers and surgeons tomorrow, we need good education reformation. We will need we need scholarship programs that we have international students, okay, a water scholarship to come to the United States, the UK, Uganda, wherever country, just to go for a study and come back to Liberia. The government of Liberia need to take things seriously. They are the ones that are holding the country down. It's not the Liberian people. But the government of Liberia is the one that is holding the country down. They spend too much of the country proceed on salary rather than developing the country. Again, Brother Edwin, let's go to you, get your closing statement, and then we'll just close for the day.
Um, I can't talk about healthcare because I'm a Christian. Because if you're a Christian, your whole goal is for you to meet your Lord and Savior. So you gotta eat very bad so you can meet quick, right?
Man, you got very important things to do, so please don't go yet. Stay with us a little bit. Stay with us a little bit. Don't go.
So that is the goal, right? If you're a Christian,
never
that's
serious,
what
man.
you should.
Come on, Edwin.
No, but that the Wallow, like all the eloquent stuff, you make a lot of point. My brother Brian make a lot of point. All the eloquence, right? Like I said, the people used to be afraid of all in that West Africa. We used to be walking with our chest off, even though we're short a little bit. Like average Liberian man height is about 5'6" or whatever. But the people used to be afraid of all in that West Africa because we had that gift. All the healthcare, whatever thing that we're practicing, we had that eye before everybody. The only difference is there's so much blood being spilled on the land. Todman, when you were there, the Freemason people that used to be killing people, boiling people's skin in Maryland over there. Toba came in, his own brother. He had to kill his own brother in broad daylight because people were killing. Before we hit the Civil War, we need mental rehabilitation in that country. And start looking at everybody as something. Liberian people are very capable. We're the very first on the land. We're capable people. We're not saying out here. Look at, we could be at work right now. We on a podcast. We got our own. My brother Brown created, put his stuff in his stuff. That's Liberian people right there. I'm a creator myself. We create stuff. We don't follow people. But no, nothing gonna be happening to us until we acknowledge what's going on. And then acknowledgement is evil. Evil is haunting people in America here. No matter what good job they have, they put. I know people that making $100,000 a year. That gas can fill that tank because the evil haunting them. We need to get rid of evil. We need to put our head in the dirt and pray to God. And pray to God. I'm not saying, I know Liberian kids that used to go to school with only pen in the pocket. They don't write nothing. I know 14-year-old kids. That's us. What is that without God? We need to pour ourselves in ourselves in the mud, bury ourselves. That's why you see a lot of educated people going for CDC. That's a CDC is an evil spirit. CDC is an evil spirit, a haunting, lot of educated people and so-called people. You don't even know that. So I'm not gonna go there. So I don't want to take you guys over here, guys. But I'm gonna stop right here.
Okay.
I think you've been
Fasting and pray.
no, you've been avoiding the court of God on your life. I think you driving there small.
Coming back
I
small,
think
small,
you
right?
coming you coming there small. You coming small, Edwin. Coming small. But I think it was a nice conversation. Thanks to you, my brother Edwin, and CEO. Thanks for the moderation. I think the topics presented today were discussed. My hope is that the Liberian government would be able to control this narrative. Okay, nothing has been confirmed yet about Ebola in Liberia. Uh, if there is if there is a confirmed case in Liberia, I want Liberians to know that we have the infrastructure. Okay, it may not be 100%, but we have the infrastructure that can actually handle that. So I see a government that is very, very confident about the logistics they have to handle this Ebola issue. And let us be able to listen and follow the government's leading. Let trust the information they put out there for us as citizens, and let us not create a public pandemonium, okay, because that would not be necessary, right? So let's just take some precaution, okay. Avoid direct contact with people, body fluids, avoid that. People that are sweating, saliva, vomiting, feces, you know any kind of body fluid, just avoid that for now. Take precaution. Wash your hands constantly. Practice good hygiene. That is washing your hands. Sanitize your hands if you can. If you don't have sanitizer, you can use soap and water. Wash your hands. We have that in Liberia. So that just for you to take precaution. But as things stand today, uh, there is no confirmed case of Ebola in Liberia. Okay, and let's tell God thank you for that. Let's continue to pray for our country, pray for our president, pray for our leaders to lead us in the way that will help the country move forward. So thank you. We look forward to hearing your response. Text us, message us. If you disagree with something we said on the platform, want to hear from you, and we'll respond as well. See you, and Edwin, thank you so much.
Thank you. All right. I just want to say thank you to the listeners and viewers at this time. And I also want to say thank you to my brother Edwin Poor and also to Dr. Wallow for your commentary tonight, as always. And again, to the Liberian people, like we can sit here today while breaking down the audio of Paula Bidell. We can say that it has not yet been confirmed in Liberia there's an Ebola crisis or Ebola outbreak. Again, I don't think this nurse or this healthcare personnel, Paula Bidell, wanted to instill panic in the Liberian community. I would not say that that was her position. And again, I think she spoke out of love and urgency of the matters.
Yeah.
But again, it wasn't the place for her to address this issue outside of the PR of the hospital or rather than the Ministry of Health. Again, Liberians, let it be alert. There are Ebola crises around us. And remember, we migrate a lot and we have a lot of businesses going on in and out of Liberia. Let's be very mindful of what we do. Our healthcare system cannot provide the services we need in Liberia. But yet, then still, we want to thank the healthcare workers in Liberia, the nurses, the doctors who are doing their best, working with the bare minimum to provide safety and services to our people in Liberia. It's a call for the government of Liberia to fund these hospitals fully where they can function to the maximum potential. Again, let us do this. Liberia, if Liberia cannot do it for herself, no one else gonna do it for Liberia. Vote. Voting is very important. Vote wisely and vote the right people in office. Again, thank you, ladies and gentlemen, my brother Edwin and Dr. Wallow. You guys have a wonderful Sunday.
Free
Edwin,
Paula be there. Free Paula be there. Free
con-
Paula be there. Nigga.
congratulations to your son, Edwin. Congratulations to your son.
Thank you, Dada Walla. Free
Man,
Paula be there. Free
my
Paula
man,
be there. I'm putting a new
what,
shirt.
my man, when you get to the
Oh,
graduation,
let's
after the graduation, call me. I want to talk to you and the mother on FaceTime, my man. Call me.
no problem, bro.
Congratulations
Free
to you
Paula
and the
be
family.
there. Free Paula be there.
All right, bye, guys.